Bismillah ar-Rahman ar-Rahim. Today our topic is fluid and electrolyte. So it is fluid and electrolytes. Our learning object is the anatomy and physiology of the body fluids and electrolytes. We should know the anatomy and physiology and of the body fluid and the common acid-base imbalances and their treatment. A minimum urinary output of approximately 400 ml in 24 hours is required to excrete the end products of metabolism. Means a normal person who can excrete the urine, the urinary output should be up to 400 ml at least. Any our surgical practitioner, maybe start from house officer to the professor, we are treating the surgical patients and we should know the basic knowledge of fluid, electrolyte, acid and balance disturbances, as well as their causes and their management. So we should know in detail. So today in this topic we will discuss the fluid requirements and what kind of fluid is to be used in a surgical patient. So normal distribution of water or the body fluid is the total water constitutes 50 to 80% of a total body weight depending on age and body mass or the muscle mass. In a young man of a 70 kg, it contains 55 to 60% of body fluid. Females 45 to 60%, and in neonates 80 to 85%. So it is very important to remember for us. The young man who is having 70 kg, it is having 55 to 60%. Females are 45 to 60, and the neonates 80 to 85%. So total body water, it is divided into two. Total body water is divided into two. One is intracellular, another one is the extracellular fluid. Intracellular fluid comprising 2/3 of the total body water, while extracellular fluid comprising 1/3 of the total body water. Intravascular, it contains, which is plasma, it is 2/3. Interstitial comprises 1/3 of the extracellular fluid. Now the average water in average daily water exchange. So in a urinary output, at least 1500 ml, it is excreted from our body, and insensible losses are 1000 ml up to 700 ml in a hot climate like this. This is the very hot climate in our Pakistan. So insensible, it means in the case of sweating. So 1000 ml to 700 ml in a hot climate. In a stool, 200 ml of fluid is excreted, while in a total 2700 to 3400 ml is to be excreted daily. So endogenous intake is a 200 ml from oxidation of ingested food, and net requirement of water is a 2500 to 3200. So minimum urinary output of approximately 400 ml in 24 hours is required to excrete the end product of metabolism. थोड़ा सा इमेजिन करें, हम ऑपरेशन करते हैं, सर्जरी के बाद इसको पेशेंट्स एडवाइस करते हैं फ्लूइड विच इज़ रिंगोलेक्ट और डी विच IV 8 hourly. So this fulfill the requirement of this 2500 to 3200 ml of the fluid is required for our total body maintenance. So total body water, again this slide shows male is 60% of body weight and female is 50% of body weight. So body water, intracellular and extracellular. Intracellular, which is 66%, is contains potassium, magnesium, phosphate and protein, while extracellular fluid contains sodium, chloride and bicarbonate, and plasma is 1/3, interstitial fluid is again 2/3 of the fluid. So now just come to the body fluids, IV fluids composition. In IV fluid composition, as we know, we are frequently using normal saline, dextrose normal saline, Ringolect normal saline, sodium chloride and dextrose water 5%. So these fluids are commonly used in our surgical practice. So we will discuss each and every normal saline, Ringolect, dextrose saline as well as dextrose water in detail in further slides. But in the normal saline, as we see, there is a sodium which is 154 milliequivalent per liter. So the sodium concentration in normal saline is 154 milliequivalent, while in a chloride is the same 154. In case of Ringolect, this is RL for Ringolect, Hartmann's solution or the Hartmann solution. It is a normal, sodium is 131 milliequivalent, potassium is 5 milliequivalent, calcium is 2 milliequivalent, chloride is 111 and lactate is 29. This is a ratio in 1 liter of Ringolect or the normal saline. So in 1 liter of Ringolect, it contains sodium 131 milliequivalent, potassium 5 milliequivalent, calcium 2 milliequivalent, chloride 111 milliequivalent, lactate 29. Same as in case of dextrose water 5%, it contains 50 gram of glucose. So now we will come to the for the principles of fluid therapy. What are the indications and principles for the fluid therapy? So indications for fluid therapy is for the rapid restoration of fluid and electrolytes in a dehydration. Dehydration is due to vomiting, diarrhea, shock due to hemorrhage or the sepsis or burn, and in total parental nutrition, anaphylaxis in case of cardiac arrest or the hypoxia, post gastrointestinal surgeries, and for maintenance, replacement of loss as a special fluid. So this was the indication for the surgery. Now problems can be created due to fluid therapy. Problems, what kind of problems are common? Commonly, when we advise the fluid therapy to the patient should need the hospitalization. And hospitalization, it is costly, it needs asepsis. We can also face the fluid overload like pulmonary edema and cardiac failure, infection, thrombophlebitis, hematoma, cellulitis in a local area, pyogenic reaction, air embolism, bacteremia, discomfort, patient's discomfort, poor patient acceptance. So daily requirement of sodium is 100 milliequivalent, potassium is 60 milliequivalent. So calcium is 5 milliequivalent and magnesium is 1 milliequivalent. So what kind of problems we will face? We will face patient needs hospitalization, fluid overload, thrombophlebitis, pyogenic reaction and discomfort. These are the problems in fluid therapy. So you should remember. Now fluid therapy. There are two types of fluids therapy, which is one is the crystalloids and another one is colloids. Now crystalloids. Crystalloids are aqueous solution of mineral salts or other water soluble molecules. So this is the crystalloids are the solution of mineral salts, and they are used mainly to improve the volume and electrolyte supplementation. Here again, these are the solution of mineral salts, and they are used to improve the volume as well as electrolytes and electrolyte supplementation. So 1 liter of this crystalloids. So first of all, you should know what kind of fluids which contains crystalloids. Normal saline, Ringer's lactate, and other crystalloid fluids are dextrose saline, dextrose 5%, and isolite P, isolite G, and isolite M. These P, G, and M is not used in our Pakistan, and I haven't seen this type of practice. But normal saline, dextrose 5%, Ringer's lactate, and these fluids are frequently used in our surgery. So normal saline contains again 154 milliequivalents of sodium. Ringer's lactate is the most physiological fluid. Crystalloids containing sodium, potassium, chloride, lactate, and the calcium. Now sodium is 130 milliequivalent per liter, and potassium is 4 to 5, chloride 109 or 111, and lactate is 29. Calcium is 3 milliequivalent per liter. It should be avoided in liver failure patient. Ringer's lactate or the normal saline. The Ringer's lactate especially, it is avoided in liver failure patient as it does not contain glucose. It can be used in a diabetes patient. So in diabetes patient we can frequently use the Ringer's lactate solution, but not in liver failure patient like in hepatic encephalopathy or the jaundiced patients. It should not be used. So this is slides for calculation of drops per rates per IV fluids. 1 ml is equal to 16 ड्रॉप्स इन ए यूजुअल ड्रिप सेट. नॉर्मली जो हमारे पास अडल्ट के अंदर ड्रिप सेट हम इस्तेमाल करते हैं उसमें 16 ड्रॉप्स आर इक्वल टू 1 ml. मतलब अगर आप उसको 16 ड्रॉप्स दे रहे हैं तो वो इट इज़ इक्वल टू 1 ml तक होता है. इन केस ऑफ माइक्रो ड्रिप सेट especially it is used in case of children's or through infusion chambers. This is micro drip set. It contains 1 ml contains 60 micro drops. So the quantity of fluid is required for in liters per day into 10 is equal to drop rates per minute. So 22.5 liter is usually used quantity of a fluid per day. So 2.5 into 10 is equal to 25 drops per minute. It means 2.5 liter of the fluid with the ratio of 25 drops per minute. So we can use in 24 hours. So fluid volume in ml to be infused in 1 hour divided by 4. The number of drops per minute, for example 100 ml per hour means 25 drops per minute. So this is the fluid calculation, okay, how much amount of drops per minute to be given. So you normally इसको याद रखिए कि 1 ml is equal to 16 drops and 60 micro drops are equal to 1 ml in case of infusion chamber or for the children's. So if we use daily required 2.5 liter, then the 2.5 into 10 is equal to 25. So 25 drops per minute we can give up in 24 hours, so we can reach the target of 2.5 liter. Now crystallite solution. Commonly the crystallites are used, as I have told in the previous slides, dextrose 5%, 10%, normal saline and Ringer's lactate. These are the common crystallites which are used. So now I will little bit discuss in detail the 5% and 10% of dextrose water. It contains 1 liter 50 gram of glucose. It is a hypotonic. It has a pH of 4.5 and provides 170 kilocalories per liter. So what are the indication of this 5% or 10% dextrose water? Why? So this is pre and post operative fluid therapy as a protector of liver in obstructive jaundice, pre-operative in biliopancreatic surgery. It clears the toxic substances in the correction of hypernatremia due to pure water loss like diabetes insipidus, and excess use of electrolyte. 5% dextrose is infused with furosemide. So these are the indication. Again I will repeat it. We can use 5% or 10% in pre-operative and post-operatively fluid therapy as a protector for a liver, obstructive jaundice, and we will perform a surgery on hepatobiliary tract because of the post-hepatic jaundice like obstructive jaundice or any pancreatic surgery ahead of the pancreas. So the 5% or this 10% dextrose is very important. And also we can correct the hypernatremia in case, and also due to excessive infusion, excessive use of electrolytes. So dextrose water can be used along with the furosemide or the Lasix. Contraindications and problems. Excuse me. The contraindications, what are the in case of cerebral edema, as it is hypotonic, cranial surgeries, stroke, or it can cause it excuse me, hypovolemic shock. It may cause the hyperglycemia and osmotic diuresis. So we cannot use in case of cerebral edema, hypovolemia and water intoxication. It should not be used for the rapid correction of the hypernatremia and diabetes. So what are the contraindication of 5% or 10% dextrose water? These are the cerebral edema, hypovolemic shock, water intoxication and diabetes. Now we will come to the normal saline. Now in normal saline, this is isotonic saline, 0.9% sodium chloride. This is usually normal saline. 1 liter of contains 154 milliequivalent each of sodium and chloride. Then 150 milliequivalents of sodium and 150 equivalent of the chloride. So again, it's an indication. It is used in it exists in extracellular fluid to maintain osmolarity, and it increases the intravascular volume and is so very useful to stabilize the blood pressure in case of hypotension, in case of hypovolemia. So normal saline is very useful to stabilize the blood pressure. It is used in diarrhea, vomiting, and excessive sweating, and the treatment of alkalosis and hyponatremia. So diabetic ketoacidosis, hypercalcemia, and in a brain surgery and injuries. So it is used in giving a wash to body cavities like peritoneum or any wound. Warm normal saline, as you have seen, and most of our house officers as well as students now, you are seeing that in case of peritonitis, and we will wash the peritoneal cavity with the normal saline, hot or the warm normal saline. So avoidance of a normal saline is in a hypertension. If the patient is hypertensive, don't use normal saline. Preeclampsia in case of gynae patient and elderly patients. Dehydration with hypokalemia, large volume infusion may cause the sodium retention and hyperchloremia. So the contraindication or the avoidance of normal saline is to avoid in hypertension, preeclampsia, elderly patients, and don't to transfuse large amount of this normal saline, because it will cause the sodium retention and hyperchloremia. Now another crystalloid is dextrose saline. Dextrose with normal saline, and a dextrose 5% and normal saline is 0.9%. This is dextrose normal saline. Dextrose normal saline with 0.45% in case of children. So 1 liter, it contains 50 gram of glucose and 154 milliequivalent of each of the sodium and chloride. So it has a pH of 4.2. So it corrects the hypovolemia and hyponatremia, and it is used in alkalosis due to the vomiting and nasogastric aspiration. So the contraindication of dextrose saline is it is not used in a cardiac and the renal failure. The used in a shock, but not used in a severe hypovolemic shock. Now come to the point on the another crystalloid which is very commonly used in our surgical practice. This is Ringer's lactate or the Hartmann's solution. Ringer's lactate जिसको आमतौर पर हम लोग कहते हैं रिंगोलेक डी. तो Ringer lactate solution or the Hartmann's solution, 1 liter of Ringolect contains 130 milliequivalent of sodium as a sodium lactate and 109 milliequivalent of chloride and 4 milliequivalent of potassium and 24 milliequivalent of bicarbonate, 3 milliequivalents of calcium, and it is devoid of glucose. So Ringer's plain, this is it is not contains glucose. While Ringolec D, it also contains the glucose along with all sodium, potassium, bicarbonate, and calcium along with glucose. So in case of Ringolec D, okay. So indications why we use the Ringer's lactate. The Ringer's lactate is used in the correction of severe hypovolemia as it expands the intravascular fluid volume rapidly, and it is useful in managing the metabolic acidosis as lactate lactate in a liver is metabolized to bicarbonate, and it is useful fluid in post-operative periods, burn and diarrhea. So in our surgical practice, it is commonly used Ringer's lactate, and it is also corrects the hypokalemia, and it maintains a normal extracellular fluid and electrolyte balance. In a diabetic patient, the ketoacidosis, it provides the glucose-free fluid. So the contraindication, or why we not use these Ringers, the contraindication is it can causes the lactic acidosis, so contraindicated in hypoxia. It is also contraindicated in severe shock, liver diseases, and in vomiting and in nasogastric aspiration, in metabolic alkalosis. It can be used along with blood transfusion. It cannot be used with blood transfusion, as the calcium Ringer's lactate can bind with citrate of transfusing blood, precipitating clotting of the donor's blood. So again मैं इसको repeat करता हूँ. So it cannot be used along with the blood transfusion. यानी एक हम अगर blood transfuse कर रहे हैं patient को, तो उसके साथ रिंगोलेग या रिंगर्स लैक्टेट, हार्टमैन सॉल्यूशन, ये आप इस्तेमाल नहीं करेंगे. क्यों नहीं करेंगे? बिकॉज इसका जो कैल्शियम है रिंगर्स लैक्टेट का, ये बाइंड करेगा विद द सिट्रेट ऑफ ट्रांसफ्यूजिंग ब्लड, प्रिसिपिटेटिंग क्लॉटिंग ऑफ द डोनर्स ब्लड. सो सिट्रेट कहाँ होता है? सिट्रेट जब हम ब्लड कलेक्ट करते हैं एक बैग के अंदर, तो उसके अंदर ऑलरेडी सिट्रेट मौजूद होता है. तो कैल्शियम सिट्रेट के साथ बाइंड करके फिर प्रेसिपिटेट करेगा कोगुलेशन को, क्लॉटिंग इसके फैक्टर्स को. तो इसलिए रिंगर्स लैक्टेट इज नॉट टू बी यूज्ड अलोंग विद द ब्लड ट्रांसफ्यूजन. ओके. Now, and other these were the crystallites. Now on colloids. So colloids are of large volume which shift the fluid from interstitial compartment to intravascular compartment and are used as a plasma expander. So what are the kinds of colloids in Hemacil? They are hetastarch, pentastarch, dextran 40-70 or the 70-40. So commonly in our Pakistan we are using, commonly in our surgical practice, the Hemacil or the dextran is used. Colloids. Again colloids, the albumin. The albumin, they are heat treated human albumin, and it contains 75% of plasma oncotic pressure. It is the vehicle to transport many low molecular substances including drugs. So this albumin, this is a 5% and 25%. It is I have two percentages, the 5% and 25%. 5% is human albumin. It contains 50 grams per liter as a colloid osmotic pressure of 20 millimeter of mercury, and its effects last for 18 hours. If we will transfuse the 5% of albumin which contains 50 grams, its effects remains 18 hours, and it increases the volume 1.1 ratio. While 25% human albumin, it contains 250 grams of albumin per liter. It has got colloid osmotic pressure of 70 millimeter of mercury, while 5% it contains 20 millimeter of mercury, and it contains pressure of 70 millimeter of mercury. Expands the intravascular volume 5 times more by shifting the fluid from extravascular or interstitial space to intravascular space. It should not be used in hypovolemia. So, what are the indications to use the albumin? The indications are it is used when the rapid plasma volume expansion is needed, like in burn, in correcting the hypovolemia. 500 ml of 5% albumin is infused at the rate of 2 ml per minute. 2 ml means, yes, 32 drops per minute. So, which is equal to 2 ml per minute. So, 32 drops per minute. Okay. So, albumin can create the problems. It is, yes, it is contraindicated in cardiac failure, in anemia. It can causes the allergic reactions, nausea and febrile reactions. Okay. Another colloids are dextran, and these are the bacteria, leuconostic, but we will discuss in detail another Hemacil, which is very common. Hemacil, it is 500 ml bottle with active ingredients of polyglycine. 1000 ml of Hemacil contains polypeptide of degraded gelatin. It also contains sodium and chloride of 145 millimole, means 0.85 gram, and calcium is 6.2 millimole, which is 0.25 gram, and potassium is 5.1 millimole, which is 0.20 gram. So traces of phosphate, sulfate and anionic polypeptides. Its molecular weight is 30,000 with 1.7 viscosity. The Hemacil should be stored in 2 to 25 degrees of centigrade. Hemacil does not induces antibody formation. So the indications for Hemacil, it is used as a rapid volume replacement in a circulatory collapse, like in a shock, burn and in trauma. This is emergency use of Hemacil. So it is infused rapidly at a rate of 125 drops per minute. So beta blockers, H2 blockers like cimetidine or ranitidine should be given along with the Hemacil, as it releases the histamine. Okay, so the point is H2 blocker like cimetidine and ranitidine should be given along with the Hemacil, as it releases the histamine. It also improves the plasma volume rapidly and remains for 5 hours. It will not interfere with the coagulation, blood grouping and cross matching. It is used also in a heart-lung machine. Hemacil can be mixed with other IV fluids and drugs, like Hemacil can be infused up to 2000 ml only. So it can causes the problem, yes, rapid histamine release and anaphylactic reaction can develop in case of rapid infusion of Hemacil. So again, this is another slide for average daily water balance of healthy adult in temperate climate. It is of 70 kg, as we have discussed in previous slides. So this was the daily requirements of fluids, and inshallah we will discuss another topic very soon, like nutrition. You should enjoy, I hope, and thank you very much for listening with the conscious.